Hello, I'm Dr. Ben with Silverbush Physical Therapy, where you get one-on-one care. I'm going to show you how to release your forearm and wrist muscles. These muscles get tight when we use our laptops, carry things, and do any kind of lifting at the gym. And it's especially important to release this area if you have tennis elbow, golfer's elbow, or just a wrist sprain or strain. Most of the time we're going to be releasing this area here, as the area below that is more tendinous. A couple ways we can do this. We can take the knuckles of the opposite hand and apply overpressure. Just make sure you're not hiking your shoulder. And alternately, you can bend your arm, take your thumb and wrap around like so. That's what I'm going to use. So to work out the muscles that extend your wrist, this motion right here, you're going to place your thumb, you're going to extend the wrist, and you're going to try to move your thumb over wherever it feels the tightest. So this is an area that's going to hurt, but it's going to be a good kind of pain that reduces and goes away as you continue to hold. Don't push through more than moderate pain and hold up to 30 seconds to release the spot. Next, we're going to work on radial deviation, this motion. So you're going to bring your hand over here, go inward, find the tight spot. There we go. Hold that. Similarly for ulnar deviation, you're going to move your thumb a little bit over here and move it outward. Ooh, there we go. Now for wrist flexion, you're going to turn your arm over. We're going to place the thumb roughly over here. Now be careful, not only for this part of the forearm, but for the forearm in general, that you're not pressing on a vein. So raise up, find the spot, here we go. Again, holding that until it releases, up to 30 seconds. And similarly, we have our forearm muscles, the muscles that do this and that do that. So for the two muscles that do this, place the thumb over here, work on turning your thumb down, hold that, and for supination, turn palm up, press down about right here. There we go. We can also work out parts of a couple elbow muscles. So the brachioradialis helps bend the arm like so. So we can come on the side over here and bend the elbow. Similarly, we can get a bit of the brachialis by going like so. Hold at the first point of pain. I feel this here, so I'm not going to bring the arm all the way there yet. So again, for each of these spots, you want to overpressure up to 30 seconds once a day. If you're pressing on an area and it starts to get a little bit red, that's okay. That's the normal histaminic response, but make sure to not keep pressing that area, because if it gets too red, you can start to break skin. Similarly, if you're pressing and you notice any numbness or tingling, recheck where you're pressing, make sure you're not on a vein and that you're on muscle, because you shouldn't feel anything radiating down your arm. If you can support our channel, we'd appreciate it. If you'd like to make an appointment, give us a call. And if you like our videos, remember to like, comment, subscribe, and share them with anyone you think they may help. Thanks for watching.